Throughout our working lives, we're constantly told to save and invest so our retirement years can be stress-free. A few things can throw that plan into a tailspin, like the need for long-term health care. It is one of the biggest and often most unpredictable expenses. Here to help us out is Cory Sickles, president of Safe Harbor Retirement Group. Good to have you, Cory.
Thanks to be here.
All right, if you were a betting man, what would you tell me the odds were of somebody needing long-term care?
50-50.
That's a big odd.
That is a big odd. And, you know, with us living longer,
yeah, and
more than anything, it's probably going to even be higher for our generation. So the one thing I would definitely say, if you don't have a plan today, you need to have one tomorrow. The
cost is pretty high. So what would you say the average out-of-pocket cost is for care?
Today, it's about $140,000. For, you know, that's typically the average cost. It's a little over, you know, a little over 2 years of cost.
Okay.
And that's just standard cost. It's not included memory care or anything like that.
And that's what you're saying. So you want to plan for what? How many years of long-term care? Because we don't know. So do we plan for a year? Do we plan for a decade?
Yeah, I think you want to be in somewhere between that 3 to 6 year time frame.
Okay.
And you know, today it's about 2.3 years, somewhere around there. But you know, we're living longer. I think the baby boomers will probably extend that, and our generation will probably be a little bit more as well.
If assisted living or memory care is needed, that figure you gave us will likely go up. So what is that kind of figure covering? What kind of care are people receiving for that?
So today what we're really talking about is it's not really full-blown nursing care.
Okay.
Now what you're really looking at is a combination of assisted living, or even someone coming in to be able to take care of you, what we call it, you know, in-home care as well. So we're not even talking about, you know, going in, like I remember, like my grandparents were a true nursing home. You know, all that's kind of shifted, you know, in the last 10 to 15 years.
Now, if you do need 24-hour care, you're going into one of those facilities, that $140,000 isn't even going to get you that far. So that number could be pretty, you know, low.
It is low. You're looking right now for memory care somewhere around $7,000 a month in Central Ohio. And in some cases now, even with dementia and Alzheimer's, that lifespan can actually be a little bit longer.
Okay.
So it's not like, you know, it's not that 2 to 3 year time frame now what we're talking about for memory care.
So paying for it, what about Medicare? Is that covering any of this long-term care needs?
No, the short answer is no. Medicare will only pay up to 100 days. And that's really basically if a doctor says you go to a certified facility. But after the 100 days, you're pretty much on your own.
Okay, so we've got to let people know, where do you even begin then when it comes to advanced planning?
Well, you know, you need to be able to, as I say, put something in place. And the easiest way to be able to do that today is they have what they call these hybrid type of products out there. So you know, you pay money into it, but the nice part is unlike old ones, you know, the old policies, if you paid into it, you didn't use it, the long-term care, your premium just kind of went by the wayside. So now what you're able to do is it'll actually pay for long-term care. If you don't use it, it'll pay a death benefit. And in extreme cases, you can even also come in and receive receive the premiums that you paid, you know, into it back as well.
Okay, and so this is all kind of what you need to sit down and talk to someone about. I feel as if many people don't know about all of these different options, right? They may think that long-term care insurance is the only thing out there.
That's correct, and really everybody has the need, and really the need is I'm afraid in case I have to actually spend more money later on in my life. And really all you really need to do, you know, you can come in and set up a complimentary no obligation with me, for example, and we're going to be able to sit down and go over what your options are. And then once you're educated on what your options are, because I'm sure a lot of people are unaware of what's even out there,
sure,
then you can make a decision on what's the best way for you to go.
Definitely. All right. Again, Cory mentioned they have a complimentary first meeting, so no risk. Just come in, talk with him and his team, and kind of see where you stand. And of course, you know, this one big thing that you don't always think about, but you need to, and that's the message today. So again, it is Safe Harbor Retirement Group. Cory, thank you so much as always for being here.
Thank you.